So what's new with you?
Same old, same old. Just trying to fight the good fight. But I'm well, and my family's well, so that's important part.
Yeah, that's really it.
I have a COVID grandbaby, so that is amazing. Um, she's almost 5 months old now.
mhm.
So, and she's doing just fine. So, unfortunately, her dad is deployed,
Mm.
but they're doing well.
So when you say COVID grandbaby, you mean born during this time, or
Yes.
somebody in the family had it?
No, nobody in the family. Fortunately, nobody in my family has been stricken with the illness. But yes, she was born in June. So that was, my daughter said that was quite an experience.
Wow, where did she deliver?
In El Paso.
Okay, so at a military hospital, I assume.
Actually, no, yes, it wasn't the military hospital. Yes. And everything was fine. Her visits were different and things looked a little different, but it went just fine.
By June, they should have had some idea what they were doing.
Yes,
at the
indeed.
hospital. Yeah. So to start out, please just introduce yourself, what your position is.
Okay, my name is Sandi García, and I am the Center Director for Salud Family Health Center in Fort Morgan.
Right. And that's a federally qualified health center.
Yes, that is correct.
That serves a large population of otherwise underserved people.
Yes, in Fort Morgan, we have a population of about 13,000, and we have a very high population of Medicaid patients. We have a very large population of people that do not speak English. Spanish is their first language, and also a fair population of Somali-speaking only patients.
And
We have
Go ahead.
also have a number of patients who are not legally documented in the United States. Therefore, Salud Clinic is their only possible place of receiving healthcare.
So this would be a challenging job in normal times, right?
Yes.
And how's it been during the pandemic?
During the pandemic, I have 23 years experience working at Salud as a medical assistant, which I still am an RMA, and then transitioning into leadership position. It is challenging because we have a very diverse population. I've heard that 28 languages are spoken here in Fort Morgan, which is phenomenal for a very small, out-of-the-way rural community. And also for the high needs, because we don't have access that urban facilities have. We don't have specialty clinics. We don't have, or specialty physicians. So we do a number of things here in the clinic. So yeah, it is challenging. We see a lot of patients every day. When COVID hit, the pandemic that none of us ever expected we would ever live through in our lifetimes, because we're too advanced as society.
Mm-hmm.
I guess we changed that. We had to close. Literally, we did not completely close the facility, but our whole model of operation changed. It used to be you called your doctor because you were sick and you needed to be seen.
Mm-hmm.
And all of a sudden, you called your doctor because you were sick and you were told you couldn't come into the clinic.
Mm-hmm.
And that is basically still in effect. Fortunately, we were able to change to a telehealth model, something that had been discussed for years, but there was no pay source for it. So, of course, it wasn't something that we could do. And it became a reality, which was amazing, because normally, as you well know, Mark, the process for rolling out a new process takes weeks and months of planning. And this happened in a weekend.
In a week.
And it probably went better than the ones that take weeks and months to plan, because we just did it. I wasn't sure. We had some issues and we had to try and figure out how to do it. And I think we still have some issues. And I'll get into what those issues are later. But all of a sudden, like I said, patients weren't able to come into the clinic. We were allowing very, very few people in. We had to furlough staff. We had people trying to work from home, which added a whole level of difficulty because there were a lot of technical issues. I was one of the fortunate ones in that I came into the clinic and worked every day. I wasn't ever furloughed. I wasn't ever working from home.
And were you at your desk when you were at the clinic, or where were you?
No.
What were you doing?
I spent 5 months working at the front desk as basically as a receptionist, so to speak, as our first level of contact. Something that I had never been trained to do because I came from medical into this office, not as an office manager, so to speak. Fortunately, my lead customer service associate is what we're called, was very kind in training me and very patient. I told her at one point, you should just fire me because I'm really not good at this. But the whole system was our front door became locked. And to this day, it is still locked. We had a doorbell, a video type of doorbell that was installed. And I became the person who checked patients in. I was, and until just literally about 6 weeks ago, and checking temperatures, asking questions to make sure that they were COVID symptom or any kind of viral illness symptom free. So that's what my new role was, along with the other. But I spent 5 months out of my office. Literally, I was working at the front desk. The only time I came in is if I had a Zoom meeting that I had to attend. And
when did that start? When did you close it? When did you lock the doors?
April. We locked the doors in March, and I can't give you the exact date because I honestly don't remember. In April is when our staff furloughed. But it was mid-March that we started shutting things down. That we started restricting patients from coming in.
And how much of your staff have you had to furlough?
We furloughed all of our dental staff. We furloughed part of our behavioral health staff. We did not furlough any of our medical staff, but part of our staff was, they just started working from home. So we scrambled. Our IT department came up with computers, and they struggled through trying to figure out how to make appointments happen via the telephone.
And so when you say telemedicine, you don't just mean interactive video, you also just mean phone calls, right?
Phone calls. We're doing interactive video, but we're not doing a lot of it. The problem with that is you have to have a patient population who has access to that. And a lot of them have telephone, but a lot of them don't have Wi-Fi. They don't have the ability to do a video chat. And there's still a lot of glitching with that. So if you have a population who is very IT savvy, televideo works great. If you're working from a place that has, if you're not working from home, so if you're working in your office that has good Wi-Fi, you have good solid equipment, it works great. But when you're working on your laptop from your kitchen table, it doesn't work quite as well.
Right. So broadband is a problem in your community too, even for the...
Oh, especially in a rural community. Absolutely, it's a problem. And just learning how to integrate it into our current electronic medical records system. And well, you have to make sure that they're registered this way, and you can't click this button, because if you click this button, then you have deactivated the video and it turns into just an audio. I mean, there's a lot of, we've learned, we're still learning what some of the glitches are, but having rolled this out in a weekend, you had no idea what the glitches were going to
It
be.
took me 5 minutes today, and I've done about a dozen interviews now, and it still took me 5 minutes today to get signed on. You know, I need retraining after a coffee break now at my age, but
Yeah, I know. Give me a weekend, and Monday morning it's like, oh, this is a new world. Do I belong here? I get it. And for our patients that are just trying to do this off of a cell phone, I mean, most everybody has a smartphone now, but I'm the first one to admit my smartphone is much, much smarter than I am.
Yeah.
You know, and patients don't know how to, nobody's had the training on it.
Right.
So you don't know how to activate it.
How was your support from the Salud organization? Did they help you with this? Were they able to?
Yes, absolutely. Our Salud staff has been there 100% for us, but I think it's fair to say that when you don't have that that personal interaction, you feel isolated.
Mm-hmm.
You know, Salud has 13 sites now, and we normally had at least once a month face-to-face meetings.
Mm-hmm.
And we had all the normal problems that we dealt with, so we knew what we were doing. And then all of a sudden they're dealing with all their normal.
Mm-hmm.
And then this layered on top of it, and then it's a huge layer. And so after a couple months, you begin to feel a little bit isolated. And they're just scrambling to try and figure out how to keep Salud practice open, because all of a sudden our number of visits has taken a nosedive. I mean, a huge nosedive, like less than half. So where are we going to get the funding? How are we going to keep everybody employed? We've had to furlough staff. We've had to do this. We've had to do that. So yeah, it was hard. I mean, they did a phenomenal job. They really did. I give them huge kudos.
Right. Well, and especially initially, I think having the help with the medical protocols, because there's still so much more information than a person can keep up with. But at the beginning, as they were first just saying, you know, who has to wear personal protective equipment and how do they manage it? And by the way, did you have enough? Or did you have a hard time getting it?
Fortunately, we did have enough, but we had to change the whole thing, the whole process of how we do it. Personal, our PPE now is, because we have so many clinics, we have all these different sites, everything is, instead of us ordering our own, it's ordered through the administrative staff now, and which means that it all had to be, I had to pull it all from the shelves and put it in basically in a locked room. Not because we were concerned that it was going to walk off, but because I have to report a count. And the only way that I can do that is if I have it all together in one spot. So I became the keeper of the PPE also.
As if you didn't, as well as receptionist and clinic manager.
Yes, and greeter and screener and all that kind of stuff. So yeah, it's been interesting. But you know, you have to do that because how else do we know what kind of supplies we have and how much we're going to need and what we're doing? And we still are, because there's a national shortage, we still have to do it. So I still have to do a weekly count, and I still have to have all of my departments give me a list of what they need so that I can go down to my, you know, secret stash room that I only have access to and dole out everything that we need. You know, it's a different lifestyle.
So speaking of your ever-expanding job description, first of all, how many hours are you working now, and how many were you at the max?
I'm back to probably roughly 40. I always work between 40 and 45 hours a week. I mean, I come in early and I try and be here by 7:30. I try and be one of the first ones here because it's quiet time and I can get something done. But I was probably We have calls in, I occasionally had calls in the evening that I did. I would sometimes didn't have time to get my stuff done during the day, so I would do it at home. I don't know.
Well, so how have you held up?
In June, I had what I was afraid of. I knew it was probably sinus issues because it's Colorado, it's rural Colorado, when everything is, coming up, and everybody has sinus issues here. But because of the protocols that we had in place, I couldn't come into work until I made certain that I had a negative test. And I had classic symptoms, but I think a lot of my classic symptoms were just exhaustion. I was exhausted, Mark. I was just literally exhausted. The stress, the emotional, the mental stress, along with the workload. And so I ended up out of clinic. I was at home. I had to be at home for a week. And I chose to not work from home.
Good.
I just took that week, and the first 3 days, I think I slept the most of it.
And what else has helped you get through this time besides a week off?
Let's see, what has helped. I've gotten much better at, when I walk out the door, checking it at the door. I try really, really hard not to work from home. I would much rather, I'll come in early. I'll stay a half an hour, 45 minutes, an hour later, after the doors close, after people are gone, so that I have that quiet time to finish what I need, so that I'm not taking it home with me. And I think that has helped. I feel badly for the people who are actually working from home, because you don't have that ability, I don't think, to shut it off as well.
To put it aside, yeah.
Yeah. So I've really made an effort to not work from home for that reason.
So you're at the office now?
Yes. Oh, yeah. Like I said, I've worked from the office every day. I've never been furloughed, or I've never been deferred to work from home.
Okay.
They had to have somebody here. I can't manage a clinic from home.
So even with all the staff not here, or hardly any of the staff here, still you feel like you have to be?
Yes. Well, the thing is, I had so few. I only had three. What did I have? 3 medical assistants and 1 front desk person, and 1 provider in clinic. But sometimes 2 providers in clinic, depending on what we needed. If somebody had to go home, if they had emergency that would arise, or, I was still going back and drawing blood. If they needed somebody to draw blood, I didn't want somebody to sit out in my waiting room. So, like I said, I'm still an MA. So I just take them back and draw their blood so that I can get them in and out of clinic faster. I could get them in the door. I could go screen them. I'd take their temperature, ask all the questions, get them seated, come back and get them registered in the computer. We didn't have somebody I didn't have an extra body. So when you're at lunch, tag, I'm it. So I'll do all of that. It worked. It worked.
And so of the 1 or 2 providers that you had in clinic, what sort of things were they seeing?
What we were doing with our patients that came into clinic, at first we were seeing, basically, we limited our OBs to, I think they had, you'd think I would remember all this, but my goodness, there's been so much information in such a short period of time that it all blurs together. I think maybe 5 visits is what they considered during their pregnancy.
Wow.
Yeah. And so even OBs were doing telehealth appointments, which, how do you assess? How do you assess? You do the best you can. So, but we still were keeping open OBs. We were doing well child checks for kids 2 years of age and under, so that they would not get behind on their immunizations. Other than that, all the others we could just do it by telephone visit, knowing that eventually we're going to open up and we can catch them, but we didn't want to get anybody behind on immunizations if we could keep from it.
So, given that your staff was mostly scattered too, how have they managed to keep up morale, and what have the biggest challenges been?
I think probably the best thing that happened when I was able to bring everybody back into the clinic, because what I was doing with my MA staff, I had 3 MAs that worked to begin with.
Mm-hmm.
They chose not to work from home. They said, it's not a good setup for me. I would prefer to come into the clinic. And then as they started experiencing fatigue, they did this for like 2 months,
Mm-hmm.
and they were exhausted, same as I was.
So 3 MAs who were covering 2 full-time physicians or providers, physicians and
Right.
PAs.
Right.
You know,
Plus doing testing, because at that point then we opened up and we had a tent set up outside. Well, I'll get to that in a minute. But yeah, they were, so finally I started rotating them back and forth into the clinic. And the problem that you run into with that, you can imagine, is, well, the people that are working in the clinic are working harder than the people at home. But the people at home are working harder than the people in the clinic. I mean, there was just that. Mm-hmm. Everybody was stressed. Everybody was on edge. Everybody was exhausted. And everybody was taking it out on everybody else, because the amount of stress that everybody felt was just astronomical. The best thing that happened is when I finally was able to get permission to bring all of my medical staff back into clinic. That way they could work as a team again. Because it's really hard to be a team when you're isolated from one another, right, and you're relying on technology to be your only communication. It was really difficult for them.
How many providers do you have total? Medical providers?
Right now, I have a total of 9 because of the residency program. Mm-hmm. So I have, but during the month of July, I dropped down to, for the first half of July, I had 3. For the second half, I had 2. Mm-hmm. I had Dr. Hernandez left.
Oh, he did?
Mm-hmm. He moved to, I think they're living in the Loveland. His family's living in the Loveland area. He's working in Greeley now.
For Sunrise or Banner?
For Banner. Mm-hmm. For Banner. Rebekah Hutchinson retired. Mm-hmm. Mm-hmm. And I had, at that time, I had another PA who'd been here for not quite 2 years. Mm-hmm. And she was just really struggling with the pandemic way of life and quit. And she was a single provider, single woman, nurse practitioner. Alex was about roughly 30. Mm-hmm. And lived here all alone. Her family was back in Oklahoma. And it took its toll on her. And she said, I don't want to be here doing this and be away from that far away from my family. Mm-hmm. And she couldn't, the stress got the best of her. And so she chose to leave and move back to Oklahoma.
When I was in Brush, which was for 15 years, we were never not recruiting providers. In 15 years, we were never not recruiting.
That's exactly true. That's exactly true. I had a new provider that we had hired, but she was not going to start until the 1st of August. It's actually one of our first graduate from the residency program, Morgan Hungenberg.
Oh, yes. I interviewed her.
Yeah, she's amazing. She's amazing. But she was off. And so we really had our providers, the skeleton crew of providers that we had, it was horrendous, because here I had these providers that had left.
Mhm.
I had two providers, literally two providers in the clinic, and I had all of the follow-up med refills, all of the reports and referrals and all this kind of crud that was coming in from these docs that had left, along with them being the only two. I don't know how they didn't collapse.
Mhm.
I don't know how they didn't collapse. And, you know, support staff, you can do the best you can. I was able to reach out to some of the other clinics and say, hey guys, we're dying over here.
Mhm.
Can't do it. Can't do it. And with the onset of telehealth, they were able to, and electronic health records. I had somebody in Longmont who was covering refills, all of Dr. Hernandez's refills, of which he'd been a provider here for, what, 17, 18 years. So you can imagine the patient panel that he had. I mean, he had like 25 refills a day that were coming in. So I basically off-cited all of his patient
Mhm.
requests, and I did the same thing for Rebekah Hutchinson, who'd been here for,
Wow.
Becky had been here for 10 years.
Mhm.
So that's how we helped to, you know, I learned how to, I just diverted. I did the best I could to protect my providers, but everybody was just beat, along with the fact that once this hit, then anybody taking any time off other than because you were ill
Mhm.
was just prohibited.
Mhm.
No vacation time was granted.
Mhm. Are things easing up a little bit for people?
Yes, we're now able to take, at first we were able to take 2 days. Anybody that wanted could take 2 days a month. And they definitely recommended that, you know, take your 2 days. Take
Mhm.
2 days a month because you need to be able to turn it off.
Mhm.
And now they have loosened it up to 5 days. You can take 5 days of vacation within a month, and it can be consecutive, but no more than that. And of course, now that our numbers are starting to increase, and I have had some staff that's tested positive and had to be out. Initially, when this first started, our protocol was very, very tight
Mhm.
for not only staff but patients to be able to come back into the clinic after if they'd had a positive test.
Mhm.
And so I had 2 staff members that were literally out for 2 months because the requirement was have 2 negative tests. They test negative, 3 days later they test positive again.
Mhm.
You know, as we have finally figured out, as the scientists hopefully have put this all together, that they're still shedding virus, but it's dead RNA they're shedding.
Yeah.
So that's why it was still showing up as positive. But at that point, we didn't know it, and we couldn't risk having somebody,
Mhm.
you know, which I appreciated because Salud was doing the best they could to protect all of us, you know. So
Have you had a lot of disease in your community and among your patients?
we had a huge outbreak here because of Cargill,
Right. The beef plant.
the beef plant. So, and then unfortunately, it was devastating for Ebenezer had,
Yeah.
yeah, and I'm sure you know about that. But with the beef plant, yeah, our numbers, in fact, we were the hot spot. Us and Greeley were the 2 hot spots of the
Mm.
state for a while. And that's all gradually, once that got through and people learned what they needed to do to protect one another,
Mhm.
and those protocols were put into place, that's decreased. We're on a little bit of a rise, but
Yeah. So you're seeing another little bump.
mm, yeah, not as bad as some of our surroundings. Sterling is right now, is down to, they've been restricted to a level 3
Mhm.
by, you know, Colorado government standards. The governor has imposed those 1, 2, and 3 levels of
And that's not including
restriction.
the jail, which was one of the worst hotspots in the state.
Right. So we
Because
were definitely 3 for a while. We've been lifted. We're at 2. And the rural community,
Mhm.
even with the fact that we had that big outbreak, we still have our rural farmland community that says, I've lived all my life doing this. I'm not changing the way I do things. So we've got a few of those. I continue to see people that that don't mask. I continue to have people that come to the clinic and they don't have their masks. And of course they can, but we have masks for them. They're not allowed into the clinic without a mask.
Have you had people belligerent about it when they've come to the clinic?
Occasionally, but I've learned that, well, as I've learned throughout the years, and as you perfectly well know, the best way to treat that is with kindness.
Yeah.
And just, apologizing and saying, I know that this is a difficult time and I know we're all tired of this, but I want to protect you as best I can. And so this is why we have to do this. And that's a really hard thing to explain to patients now too, when they want an appointment and they want to see their provider. What do you mean I can't see my provider? Mm-hmm. I'm sick and I can't see my provider? Mm-hmm. How stupid is that? And it's really hard when I know the reasons, but it goes against every fiber of my being as a medical professional, to be able to assure them that we're going to give them the best care we possibly can and help them and keep them protected. That's tough. That's tough to sell.
None of us thrives in isolation.
No.
Here's an interesting story. One of my children has a counseling practice in Seattle, and in March he switched his whole practice over to video. Kept all of his patients. He still has a full practice. I guess they call them clients. And Jack said, so this for him took out a commute each way through city traffic of, 25 minutes each way every day. And that was a relief. But he and his colleagues who he talks to all find it's harder. Just not having what you get from being in the same room with people, from having colleagues down the hall, it's just harder.
Exactly. This is a prime example. Even when you have somebody in the clinic that you're talking to, right. You have no idea whether I'm smiling or whether I'm frowning or whether I'm sticking my tongue out at you. Mm-hmm. You can only see so much through a person's eyes. And that's another level of isolation, I think, is not having that. It's amazing how much we take for granted. And oh my goodness, this has really helped me to realize how much we take for granted. That nonverbal communication. Yeah. And being able to see facial expressions, because you not only hear them in someone's voice, but you see them in their face and in their body stance, and we can't do that now, so that's difficult. I know this is something that I found that was very humorous. One of my providers said, between telehealth and televideo, mm-hmm. Right now with the state of mind I'm in, I like telehealth better. She said 2 reasons. 1, nobody knows what my hair looks like. Mm-hmm. And 2, they can't hear me rolling my eyes. Mm. And I thought that is so true, because how many times as a provider, when you would hear this and you're trying to explain this, and you really want to roll your eyes at that patient, but you can't. When you're on telehealth, and it's amazing how just that eye roll is a stress reliever. Yeah. It really is when you stop and think about it. And I had to laugh about that. I said, yeah, that's a really good point. I hadn't thought about that.
Well, I used to think that I could hear my children roll their eyes.
That's true. As parents, we can't.
As parents, we can't.
But we hear it in their voice because we know what their voice is.
Yeah,
but
I know that, yeah.
It's very true. But then, of course, back then our children knew that we had eyes in the back of our head.
That's true.
And that we could see through tables. I remember my children saying, Mom, can you see through this table? Because my kids were sitting across from each other and they were kicking each other under the table. Well, it's pretty easy to figure that out as their bodies are gyrating. But of course, it was like, quit kicking each other under the table. How did you know we were doing that? Yeah. Well, how do you think? You can see through the table?
Yeah.
Absolutely, of course I can.
Mom omnipotence, omniscience.
Yes.
So while we're talking about that, have you gone back to counseling? Are your behavioral health people back in the loop?
Yes, actually, everybody that had been furloughed is back in. We unfortunately lost 1, 2, 3, 4 positions.
Hmm.
We lost a total of 4 positions, which was very minimal considering. Salud itself lost a considerably larger number of people
You
than
say you
that.
lost the positions. You mean
They were terminated. Those positions were terminated at the end of the furlough. I lost 2 of my front desk staff that will not be replaced. They were not brought back from furlough. I only had 3 that were brought back, and one of them was dental. We lost 1 dentist completely. But fortunately, I didn't lose any of my medical staff. And yes, our behavioral health, they went to telehealth. And in fact, their telehealth numbers have, they're doing exponentially. And of course, the need for them, the difficulty, I don't know if I should say difficulty or not, but yeah, difficulty is it's harder when if the provider's in clinic and they are talking to somebody, and let's face it, now everybody is feeling the strains, so everybody could probably benefit from a behavioral health visit. When they're in clinic, they can just pop in and screen somebody. And now they're having to do it by phone. One of the big problems that ironically we have come out with telehealth is there's so many patients who have that block unknown numbers option on their phone activated, and calling people from home.
Right.
Those numbers are blocked, so they're missing their calls. And some people don't even know how to, especially some of our non-English speaking patients, they don't even know what that means and how to unblock it. So, but yeah, behavioral health they're doing amazingly. I've had probably 4 days in the last 6 months or however long it's been that we've done this, that they've been in clinic. They're just doing literally all of it from telehealth.
And how many of them are there, and how are they holding up?
I only had 1 at the time that this started because we were short-staffed, and we just recently were able to get a new behavioral health person that hired on about a month ago, and she's doing phenomenal. But they're busy, and I don't know that I really know how, since I'm not their direct supervisor. Rarely do I ever have a conversation with them, so honestly, I don't know how they're doing.
You know, when I worked at for not long, at that Cargill clinic in town in Fort Morgan, and that's where I learned, and I speak Spanish, so I've rarely been challenged with a language barrier until I was there. And that's when I learned that there are not 1, but 3 different languages in Somalia. And so you not only needed a Somali translator, but you needed one who spoke the right language. And I can just imagine, and so we had a language line, I'm sure you do too, but what the challenges are to do this now with, with your providers scattered or trying to do behavioral health. Wow.
It is hard. It's very hard. And we did not have a Spanish-speaking behavioral health provider for a while. The advantage that we did have, and this is one thing that, like I said, it's the silver, you look hard enough, you can find a silver lining in everything, And one of the silver linings, one of the blessings that has come out of this is with people with telehealth. I might have a provider who is in Fort Collins,
Mm-hmm.
and they can take care of my Fort Morgan patient. It doesn't matter where they're at. It doesn't matter what their location is. They can take care of any patient. So this is an advantage. If I'm short-staffed here in the clinic, I can have somebody. We had what they called, we had acute care clinics, like an urgent care. We had a couple of those at some of our larger facilities, one in Longmont, one in Commerce City, one in Brighton.
Mm-hmm.
And so the providers that were just seeing these walk-in patients every day, they became walk-in, so to speak, telehealth providers.
Mm-hmm.
So the disadvantage to that is not having that continuity of care. You know how important it is to have a PCP. So, you know, there's so many levels of difficulty that you don't even think about it until like now when we start having those conversations. It's like, oh yeah, I forgot about that. Oh yeah, this is, wow, how is that affecting? There's just so many layers and levels.
So knowing what you know now, and keeping in mind, you know, it's not just that you didn't know much. Nobody did.
No, like I said,
So we
who
all
would,
did the best we could. But knowing what
right?
you know now, in retrospect, what would you have been doing differently?
Something that we should have been doing for a long time, and something that will never go back to our way of doing it, is keeping our healthy patients and our sick patients separated.
Mm-hmm.
We never thought about it. How many times have you gone into well, even as a patient, you know, I mean, we never get sick, of course, but our kids did, you know, as a patient, sitting in a waiting room, especially during the flu season.
Mm-hmm.
And you've got somebody that is, you know, coughing a lung up, and, you know, you can tell by looking at them that they're running a fever and they're miserable and they're sick. And you're sitting three seats down from them or possibly right next to them. We never thought anything about that. That's just what you do, because when you're sick, you go to the doctor's office, and you have your pregnant women sitting in the same waiting room as the sick people, and you have your well child checks, and you have your person who is completely high risk, who doesn't have a virus, but they have 3 comorbidities or 4. And you've got them sitting right there next to that person who,
Right.
you know, has heaven only knows what. And we'll never go back to that. And that's a good thing.
Yes. Yes.
That's a good thing. So we should have thought of that before.
Mm-hmm.
But usually, when have we ever thought of something ahead of time? You know, that's why. If the necessity is not there, this is the way we've always done it before, well, then that's the way we're going to do it now. Because we don't know any differently.
Mm-hmm.
And then later, of course, we look back and we say, duh, what was I thinking? There's been a lot of duh moments.
Well, they're saying that we're going to have pandemics, maybe not while you're still working. You know, maybe you'll be lucky enough to live long enough but not have to go through another one of these again.
Lord, I hope so.
But what are you thinking of doing now to prepare should another one come along? How would you, how would you prepare?
I think that we will always be aware. You know, the thing that how can you prepare? The PPE shortage.
Mm-hmm.
Nobody knew about that.
Right.
We had storages, but there are some things that you can't store because they have expiration dates.
Right.
So how do you prepare? I can't do that on my level. We can do that on a manufacturer level, possibly. That's out of my realm. But what we will do moving forward is, well, first of all, I think we're all going to be more cautious in looking for trends.
Mhm.
being more aware of what's going on around us. And I like to think about that. But Mark, you and I both know that we live in what is the norm.
Right.
So what is the norm today isn't going to be,
Mhm.
hopefully, the norm 2 years from now.
Mhm. Yeah.
So how do we prepare for what we don't know is coming? But I do know that we're in the process, Salud's in the process of figuring out how to refit and restructure all of our buildings so that we have that acute care
Mhm.
area, so that we're not seeing sick patients in the same area that we're seeing well patients, and that we never have sick patients and well patients sitting in the same waiting room.
You know, and that's one of those like, duh.
Yeah, we should have thought of that before. Better filtration. You know, the hospital has had negative air pressure rooms forever. But a clinic who sees all of this, I mean, they come to the clinic and we send them over to the emergency room. There again is that dumb moment. We've never had any of that. So, of course, better filtration systems and all of that, everything is going to come from.
So have you diagnosed a lot of people with COVID infections, and have you lost a lot of patients?
We have lost several patients. I've gotten notification of such. We have had, I'm trying to remember in our community and with Salud, I think we've had 2 patients that were what I would consider, well, young patients, somebody that's under 50, 60 years of age, not elderly, that, and honestly, I don't know what the count is. Yeah, we have lost them.
Okay. But it
We
doesn't sound
haven't,
like many, and it doesn't sound like grieving is
no,
a big part of your day-to-day life with this.
no, fortunately not. Places like the nursing homes, I can only imagine what kind of emotional chaos they must all be in, and devastation. And, you know, they have that daily contact. They're like, you know, their residents, their patients are like family members to them. And the level of grieving and
Yes.
emotional distress that they're under is just unimaginable to me. I feel badly for people like here we have one mortuary, Don Hare. You know Don Hare. You've known Don Hare forever. I saw Don Hare at a meeting, probably 6 weeks ago, and he looks awful.
Mhm.
And this has got to be really, I mean, this poor man is working day and night. He's exhausted.
Yeah. Okay, just about one more question, unless something else comes up, and then I'll give you just a chance to throw in anything else that we haven't talked about that you'd like to. Has this made you consider anything about how you want to do your career from here on out?
Mm-hmm.
What have you
Yeah,
been thinking of?
I'm looking at retiring. You know, honestly, and this is a very true statement. Before, I just turned 64. And I never thought that I would want to, you know, when the time came, retire from, I know I'll retire from Salud. But it certainly was, oh my goodness, I'm not going to retire at 65 or 66 or whatever. I feel good. I'm blessed with good health. I love my job. And I can't say that right now, Mark. There's a part of me that says, I'm too old for all this stress. And I know that sounds really silly.
Nothing silly about that.
It's just, this has been, oh my God, it has been a hard 6 months. And I know that it will even out. But there's a part of me that says, do I want how much longer can I handle all this stress? And I don't know what the answer is to that. I don't.
Yeah.
And maybe part of it is because of the administrative position that I hold. Back working with my patients. Oh my goodness, I miss that.
Yeah.
And you know what I'm talking about with that.
Oh, absolutely. Absolutely.
So I miss that part of it, trying to help direct everybody and being leadership for the whole clinic, and being able to try and provide answers to everybody. And you're going to laugh at this, but you know what I'm saying. Being supervisor for providers is hard. It's hard work.
Yes, it is.
And right now, with so many changes, it's been stressful.
Well, I know what you mean about being recharged by patients. And I think healthcare is, for me, it's too hard a job to do if you don't get that.
That reward that you get from the interaction that you have with your patient. And I've thought about, I know I have just some volunteer side work that I do. And when they call me, I go and do blood draws for somebody here in town. And I love it. It's the best part of my day every day when they call and say, hey, can you come over and do a couple blood draws for me? It's like, yes, I'm there. and really, it's the highlight of my day. And so will I retire right away? I can't quit working right away. I think I'd be bored to death. Give me a couple months to get caught up and recharged, and then I'm going to have something to do. But I want to go back to doing something like that, where I can work with patients.
Yeah, I sure get it.
Yes, indeed.
Yes, indeed. So, is there anything further that we haven't covered, or that you'd like to say? Or now, remember, when I tell people about this, I say, well, it'll be available for researchers. As just a lot of these videos. So I imagine that our grandchildren, sometime in the future, are going to say, "Boy, that was a really strange time, and I wonder what Grandma was doing." And what she had to say about it, or I'd like to hear what some people said about it. So this is your chance to talk to your grandchildren as adults. No, seriously. But if there are any other thoughts you'd like to leave, by all means.
I think I would like to believe that one of the good things that has come out of this, in all of this chaos, is that we're all more aware of how important kindness is and consideration for others. One of the things that I have discovered that saddens me is I feel that as a nation, we have become very self-centered, and that we have lost that common courtesy and respect that is so important. So important. And I think that just courtesy and kindness, I think everybody has realized how important it is, and how much better we feel when somebody uses a kind word, or treats us with dignity or respect, instead of in this just horribly fast-paced society that we live in. And I think that we need to put the emphasis back on that we have to quit being such a selfish bunch of people.
Well, I think you have a lot to teach us all about that. By example.
Thank you.
Not by lecture. That doesn't ever work. But I so appreciate your taking the time to do this. And I so appreciate knowing you.
Thank you, Mark. That's such a kind thing to say.
Yeah.
And that's ditto. Me too.